So I see Jacques Busquet has his presentation loaded now. Are you able to hear us, Jacques? Can you confirm you can talk?
Yes, I hear you very well.
Wonderful, Jacques. Well, let me just introduce you again in case people have just come into the presentation. Jacques is a surgeon in Paris, France, and was instrumental in forming ISES in those days as the first International Society of Endovascular Specialists. And you have a long career, Jacques, and a great interest in aneurysms. Please tell us of your presentation now in the history of EVAR.
Yes, I would like to give a note of this EVAR history. It's a sort of revolution, endless revolution, and try to achieve perfection. As you know, EVAR is the most common way to treat the AAA right now in all over the world. And by the way, Dr. Dietrich, our mentor, gave a very good way to our work. The ISES from 1992 to nowadays bring a lot of presidents involved in EVAR. The change was from vascular to endovascular as a true revolution. And this EVAR process of treating AAA has been honored by the Medal of Innovation in US, given to Ron Parodi, Tim Schutter, Thomas Fogatti, Rob Greenberg, and Dr. Dietrich, as you've seen just now. Classical surgery was open, safe, but long operation with transfusion and laparotomy, and so clamping, giving a less efficient follow-up. AAA, all kind of AAA, saciform, fusiform, big, oblique, can be treated endovascularly now with the new systems. And we have many examples all over the world that this technique is working. Just as you remember, Joan Parodi was somebody extraordinary to put this graft between two palmar stents to treat and exclude the aneurysm in 1990. It was a new era that he opened. And this is his primary publication. But he was preceded by Nicolas Vodolos, who was working behind the iron in Russia. But they had the same spirit in a way. Then the supraortic fixation modular system appears. And we had some key opinion leaders like Ronnie White from UCLA Torrance 9 Long Beach Memorial, very, very good presenter and operator that I thank for the education he gave me. Here you have some key opinion leader, Brian Hopkinson, who did the first rupture aneurysm, Alan Blunsen in Houston, very active. The regretted Jim Smith, who brings the endotension, and Jim May recently passed away, but look, this is the first brain Hopkinson presentation. These two men did the classification on endoleaks, and it was something very important for us to understand and treat this sort of complication. He passed away recently here with our friend in US. Gillian Smith introduced the endotension, and Dr. Wyss, who is going to speak after me, I think, did a book in a symposium with inside the symposium, and it was very, very interesting. Frank Wyss, did a lot for us in that sort of new technique. Also, Roy Greenberg from Cleveland Clinic, he brought a lot of new things in endovascular technique on the aorta, proximal aorta, with FIVAR, BIVAR, which are common technique nowadays. A note on Timothy Schutter from San Francisco. He was very inventive and he did a lot on this branch technology which are used nowadays. A word on Michael Deck, very famous practitioner. He did the first thoracic endograft. Here is primary publication, and is a so good doctor, so good presenter. This new system was used at the time. I don't know if it's still used, but it was a research that was done. Sandwich technique, be careful to the gutters, is useful in proximal aorta near the renal. Here, invented in a way by Dr. Lobato in Sao Paulo, Brazil, our good friend, trained in Phoenix. And we moved to Dr. Cribier, endovascular aortic valve, which is now the most common way to treat the valvular pathology in the cardiac system. But the future will be the stem cell therapy to prevent expansion of the abdominal aortic aneurysm, in my opinion. So I would like to thank Dr. Khanna, say hello to Dr. Reed and all the panelists, and I miss you very much and hope to see you next in New Delhi physically. Thank you very much.
Thank you very much indeed, Jacques. You've made most of us, I think, have quite a sentimental recollection of how it all began. And the thing that I noticed was how fabulously good the people were at operating. They were very good surgeons, usually, who were able to adapt to endovascular. Do you remember, if I can ask you, Jacques, the very first aneurysm case that you did? Do you remember the case?
Yeah, very well. It was in March 1992 in Paris with Dr. Ballas. He was here in Bordeaux, sorry, my former place. He was assisting me because he sent to me a trainee for 6 months. And we did the first case with Professor Ballas from Greece. Successful case with primary Mintech technology. Mintech, yeah. And then we had to wait a little bit longer to get the best graft like all the other coming after. So it was quite early.
Did you have much opposition in those days, Jacques, about this new way of treating patients?
Yes, in France we were blocked after 6 months of use because the authorities told us that the system was not safe, and we had to wait several years to be back again.
I remember.
Anyway, they didn't stop. They didn't stop us.
Jacques, thank you very much indeed. We're going to go ahead with other talks. Are you available at the end for some discussion? I see you're obviously working.
Maybe I will stop my operation to speak with you.
Oh. Okay. Thank you very much, Jacques. Very much indeed. And I look forward to hearing your comments on the panel's discussion.
Thank you.